This is a Founding Media podcast.
Hey again, guys. Welcome to Ep.08 Doc Talk. I'm your host, Dr. Ramdeen, and we have Andy Ruiz, Dr. Andy Ruiz again. Thank you. Thank you, Andy. He is a pharmacist, doctor of pharmacy, and he is the president and partner at Stonegate Pharmacies here in Austin and San Antonio. And he's a partner at Renew Pharmacies in San Antonio and co-founder of Endotech Solutions, LLC. Andy went to the University of Texas at Austin for 2 years prior to entering the University of Texas at the Austin College of Pharmacy, where he earned his Doctor of Pharmacy in 2008. And after completion of that, he assisted in the design and implementation of the first combined Master of Science in Pharmacy and Community Pharmacy Residency. And Andy always makes me read these really super long CV things because he's a really smart guy and he's got a lot under his belt. And so the Stonegate Pharmacy here in Austin is just a critical resource, and I've mentioned this before to a lot of the docs in the area in Austin and San Antonio who go to Andy for questions with things like bioidentical hormones and compounding because they're a sterile pharmacy as well. Right. But today we're going to talk about something a little bit different, CBD oil.
Yeah, something that at first regulatory bodies were not excited about. So historically it's been illegal. Yeah. So CBD is interesting, though, because it's even in states where cannabis is illegal, CBD has made its way in a legal form via hemp. Mm-hmm. So it's interesting because, you think of cannabis as marijuana, as THC, as psychoactive, and stigmas of hippie, other things like that. Yeah. But the irony of it is CBD has amazing properties to it, and it's a great substance that we can utilize, a chemical that we can utilize that our body makes naturally. I mean, if you think about the endocrine system, there is an endocannabinoid system, and that's kind of the irony, the catch-22 of this whole CBD dilemma as to how can we go with the laws, or will laws change as we're seeing them change now, and how can we really utilize these preparations or products that are good for us and healthy for us. So that's CBD is a cannabinoid in this whole spectrum of cannabinoids. Cannabidiol, to most simply put it, is CBD. So that's kind of in its simplest form what CBD is, cannabinoid. And
you mentioned this, this being analogous to one of our already existing chemical pathways. Right. But is it safe? How do we know that the particular formulation we're using is safe?
Right. That's great, because CBD in itself is safe in the sense that I think what most people have heard about it initially, and I could be wrong on that, but is when the children with seizures, right? Especially the videos that went out, just breaks your heart seeing these poor children go through those seizures, and how a hemp-derived substance could help them with their seizures. But what you nailed on there is the formulations. It's become such a hot topic, and although well-intended on the regulation of it through farm bills, etc., it allowed us to use hemp as a source for CBD throughout the United States. But in doing so, we've had a lot of people rush to market with this, and the formulations and how they're prepared could cause issue or harm in some cases, right? Are they using certain pesticides? Are they extracting it properly? What are they doing to get this CBD, right? And so the preparations themselves, do your homework, look at it, see which one is reputable, for lack of better words, something that is trusted and tried and proven to be safe and effective. So here's where it comes into play of getting to talk to your provider about it and not feel shameful, getting to talk to your pharmacist or nurse or provider in general about it, right? So is it CBD safe? Heck yeah, it's safe. You give it to a kid that's having seizures, I'd say it's pretty safe.
And so really it comes down to, like you said, Andy, the formulation, and there are so many different types out there, just like all supplements and extracts and herbs and all these things that you really do have to do your research when you choose one. And if I'm not mistaken, you offer one at Stonegate. Can you tell me why you chose that one? Or
Yeah, so we use CV Sciences, and we choose them for two reasons. One, they're one of the early adopters, early entrepreneurs that enter into this market, and they're trusted, they're reputable, they've gone through all the regulatory rigmarole early on and are still around. Two, they guarantee what you're receiving, and in doing so, you're getting these products that are have little to no THC in them. They're using hemp, right? So hemp in itself has very residual amounts of THC, right? However, it's what we'll call clinically insignificant. So that's why we choose CV Sciences, but they're also cost effective. There's some, just like anything you'll hear, you get what you pay for, right? But I also want to keep my limbs. You know, the whole saying, I don't want to cost an arm and a leg. So that's why we choose them, because they're cost effective and a great product.
Right. And one thing I just want to sidestep a little here, Andy, is that whenever we talk about any substances, supplements, herbs, extracts, anything, my blanket statement always is check with your doctor.
Yes.
Make sure you know where your labs are. There may be conditions that may require caution if you were to do something like this. And even when you do take something like this, because it's not heavily regulated, you want to watch your organ function, your kidney, your liver, your electrolytes. So anything you take, even if it's a medication, it's important that you first check with your doctor and continue to be monitored by one while you're taking it.
And it's funny, though, because you nailed it, because at first you and I may have pause as to, okay, what are the negative, or what's this? But there really are things that you have to bring up to your provider, because let's just say you try to use CBD and you're on levodopa or something that might, so Parkinson's disease, right? Or something of that nature. CBD has also been found to slightly bump up your dopamine levels, right? So if you that's not something you commonly think of. So if you start opening that book, per se, that you are to your provider, it really gives a better understanding of what is going on, especially if you're already on a medication and you start using the supplement, and you may feel better, but it is important for the long-term effects as to disclosing, hey, this is what I'm taking, and this is why I'm utilizing it. And it may be that there just may be minor medication adjustments, or it may be 100% fine. But disclosing it is, God, you have to.
For sure. And this goes for any supplement, any med, right? You just want to be able to interpret in the context of your history and current medications, really sometimes just what we should be watching out for. It may not, you may not disqualify you from taking it, but it at least will be, if we have a symptom, we can interpret it in the context of
exactly. And honestly, like, we may talk a lot of science and data, but as professionals, we use our professional judgment, right? So you may hear us throw out the word anecdote. Anecdote has a negative stigma to it. It's not necessarily a bad thing. It's through my experience, through my understanding. This is how I interpret things anecdotally. It's us just saying, I'm not going to quote some research right now, right? That's in my experience. But anecdotally, our clinical decision making, and even, do I want to conduct a research study? Do I want to read these studies? May guide us towards that. So that feedback that you may give us to provide anecdotes for us guide our decision making, our desire to look at certain research or even conduct our own research. So I think it's, like you said, it's beyond critical, because the more feedback we get, the more hypotheses that we may have. Yeah.
And that anecdotal experience and that one-on-one personalization of decision making is so important, because when you talk about supplements and things like this, what is not beneficial, I feel, is when you have a blanket statement saying don't do any of that, and then there may be patients or people that really want to try it, so now they're going to go to non-medical settings to do not just this, other things. And then if there is a side effect, they'll end up back to us with a big blind spot gap between the beginning of what they started and now. So I think it's just important to try to incorporate what people are doing, as long as it's not hurting them. And you don't know if it's not hurting them unless you're monitoring them.
That continuity of care, which you may read, it's a fancy term to just say, it's important for your providers to know where you have been, where you're going, and what's in between.
Right.
And especially with CBD, where the research has been limited throughout the years significantly. It's, hemp, if I'm not mistaken, I think our Constitution was written on hemp paper. It's really been used throughout history. It's a great source for paper, for supplements, for nutrition. But at the same time, because of laws that we've had in place, it's inhibited our research. So in times we do work off of anecdotes. It's not ideal for us, especially in the age that we're in of research and data is at our fingertips. In this case, we are limited to a large degree, to what is even available.
Especially when it's something as newly available as this. Right. You don't have these large randomized double-blinded placebo-controlled trials with thousands and thousands of patients.
Exactly.
Anecdotal information is important.
Exactly. And honestly, has there been some research out there? And you get a lot of it from like Israel and other countries. If it's written in another language, we may be hindered from how we can access that literature. So it's just not, the anecdotes are good in this case, right? Like from our experience, can we utilize this? And if the research isn't available, hopefully it can be validated in the research someday, right? Or somebody can look into that theory that we may have. But yeah, CBD has a lot, it's at its infancy right now. And it's awesome. It's awesome to be a part of. It's awesome to see. It's awesome to see people get benefits from it. It's awesome to see providers like yourself just be open and accepting of it. And, hey, let's talk about it. Let's start the discussion about it.
And again, the reason I do that is because if you just have the, paternalistic, don't do this ever, right? That may work sometimes, but oftentimes it won't. And then again, now they're out of your supervision and doing things that you can't see, and then they come back. If they do have some side effect, or maybe it wasn't the greatest formulation, you just are playing catch up.
Exactly. At that point. Try telling your children no.
Right, exactly.
See what happens.
And then, Andy, how does it work? How does it on a pharmacology level? Tell us.
So if you think about, I'll just say endocrine, right? Because immediately you should be like, because the endocrine system is beautiful, but yet complicated and intricate. So we're still understanding how it works, but the way I relate it to is natural hormone replacement therapy, where we were 20 years ago, 10 years ago, right? To where it was a stigma of like, where's this going? And it turned into this beautiful, magical thing that is just truly accepted by so many organizations.
Andy's very passionate about it.
Yes, I am. That's my bias.
It's beautiful and magical.
And complicated. But it's the endocrine system. So that endocannabinoid system that you mentioned earlier, it's a part of it, right? So CBD or cannabidiol fits on these certain receptors that in turn cause this whole cascade to occur. And that cascade in turn can cause genes or enzymes to be expressed maybe on the hormone profile, maybe in your brain, like I said, dopamine. So fully characterizing its mechanisms of action, if you will, is difficult because we know that it's had some effectiveness in premature ejaculation, right? We know if it's had effectiveness in seizures. We know if it's had effectiveness in tremors, right? So peripheral, mental, psychological inflammation, swelling, all of a sudden it's appearing to be this panacea, right? It's a fix-all, but it's not snake oil, right? There's true science behind it. And in some cases, it doesn't work for everybody. And that's something that we're still trying to identify and learn as to why does it work in patient A or individual A and not individual B, right? So what is it about that? But we know we're born, we have this endocannabinoid system, and there is this locking key that that's the key that fits in the lock. But who and how and what is something I think that we're still reading and learning about, right?
Absolutely.
And doing research on.
Yep.
But it's awesome.
Absolutely. And you mentioned dopamine a couple of times. So that's a neurotransmitter, right?
Correct.
A chemical in the brain that you mentioned can become elevated.
Right.
If you're taking it. And what conditions we need to watch out for?
Parkinson's, right? So if you have tremors and you're taking medications to help stabilize those tremors, generally it affects on the dopamine as those medications you're dealing with.
How so? For Parkinson's, are we trying to
So a lot of cases we're trying to increase the dopamine levels. And so if you're already, and then you take the CBD and it magnifies it more, it can cause too much of a tremor. It's that healthy balance. You don't want to go too high, you don't want to go too low. You're finding that key balance. And there's other medications like Provigil or modafinil that work on the alpha brainwaves, but they also work on dopamine. So you may have this enhanced euphoric feeling, although non-psychoactive, with CBD because it may give you a slight bump in your dopamine levels. So if you're taking an SSRI, some actually increase your dopamine. So selective serotonin reuptake inhibitor, or what we'll just generically call antidepressants. They may actually also increase your dopamine levels. So it's things like that it's important that you tell your provider, your doctor, your nurse practitioner of, hey, I'm taking the CBD and I feel better. Was it a cumulative effect or is it its own unique effect, right? So it's kind of hard to, but that's where the importance of talk to your provider. Let them know what you're taking. Don't be ashamed.
Right. And part of the shame and the, lack of communication comes from it being a, quote, drug.
Yeah.
And
a Schedule 1 drug at that.
Right.
It's scary.
Right. And then so one of the questions that's typically asked too is this addictive? If I start CBD oil, am I going to get addicted to it?
So that's a great point because addiction generally classified in its true form, you can't get addicted. You cannot become addicted to CBD. However, there are addictive personality types, right? That they find pleasure in certain things. So therefore, you will become non-chemically addicted, right? So if I had chronic knee pain and I needed CBD because it's going to help me, am I addicted to it? Maybe by definition, non-chemically addicted, but if you want to think of it from a chemical addiction, most likely not. You don't have the same, it doesn't act on the same psychoactive component as THC and not to the same degree as THC, right? Which is its brother or sibling, however you want to define it.
And the chemical addiction is really the important question to ask because if that, quote, addiction happens and you need basically more to achieve an effect over time and you can build tolerance and things like that. That's really concerning.
Exactly.
Because then you need more and more for an effect, and when you take it away, you can have withdrawal. But it's not that kind of addiction.
Correct. No, it's not that kind of addiction. And so that's the important thing to understand. You won't have this chemical dependence on it, this new threshold, as Dr. Ramdeen said, that you're trying to always hit and attain. Now, there are always genetic abnormalities that pre-expose people to certain alcohol addiction, right? Nicotine, tobacco type of addictions, opiate addictions. There is some controversy on does generally marijuana have some addictive properties. There's some research that shows yes. To what severity, we don't know. But CBD, to what we have seen and understood from the research, it's non-psychoactive, it's not addictive.
And then what route do you feel is best to have this administered, and what are the different types of routes? Can you tell us, Andy?
So, again, I am biased. My early research was formed around sublingual therapy, meaning under your tongue. I appreciate that route of administration because it's simplicity, purity, and history of it. So you put it under your tongue, it absorbs pretty instantly, and then from there, it avoids the liver and naturally goes through the liver for its metabolic process, right?
And are these in the form of drops that you're putting in your tongue?
Or little tablets that you can find. But the drops are by far the most common. And CBD is a bitter substance too, so you might want to get a flavor to it. Some people don't mind it. Some people genetically, ironically, are pre-exposed to enjoying bitter substances. They don't really mind. However, it is bitter. You can ingest it via capsule, gummy. With those preparations, once it's metabolized in the stomach, you have other metabolites. So it may act a little differently. It may have a longer effect. So it's something to consider if you're trying to I've anecdotally, I've had feedback from other healthcare professionals who have been veterans, right, who have experienced war and had PTSD, nightmares, the whole traumatic experience, which is understandable. They've used CBD gummies over the drops because it helps their PTSD. Their nightmares subside or limited significantly. They sleep through the night. They're less anxious in the morning. And that has been...
And these are docs that you're talking about? Or just general
one was a physician and one was a an early PharmD.
Yeah, no, I think these anecdotal stories are really
It's
helpful.
phenomenal, because it's like, never thought of that. And then as providers, we can go back and then talk to the patients, be like, look, this is what I've understood from another person. That's not necessarily how it will work in you, but hey, if it's safe, it's efficacious, it's appropriate for you, it may not be bad to at least try it and see if it's a better route versus some maybe harder medications, if you will, more harder on the body or harder on the brain versus CBD. And
other than the sublingual route, any other routes that are popular right now?
Right now, the gummies are pretty popular. I don't know if it's the idea of eating a gummy bear or something like that, nostalgic, but, which you should not bring those around children all the time, right?
Absolutely.
That's a big issue right now. But, the balms or the oil, even the unscented oil, right? So if there's joint pains, knee pains, you can rub that on the joint and it gets to the site of pain and alleviates it. The endocrine system is throughout the body, right? And it's interesting how CBD or cannabidiol is part of this whole endocannabinoid system as a subset of the endocrine system. And you, with all your training and understanding of the body, you can attest that the endocrine system is a web of this throughout your whole body. And so how would, if we apply it to the knee, how would you simply put that it would respond to the brain and throughout the rest of your body?
That's actually a really good question. I honestly can't answer that very well. So the question is, that's asked sometimes is that if it is the endocrine system working through this cannabinoid pathway, and that's everywhere, why then, if you apply it to your knee, let's say if you have knee pain, why does that help your joint pain?
The way I think of it, and maybe it could be wrong, but it's simply put, I think back to, what's that movie with the little blue creatures and they're connected to Mother Earth, but they're in this alternate universe.
I have no idea.
Avatar.
Avatar. Yeah.
So I started thinking of Avatar is that the whole body's connected, right? And to be fair, we're connected to everything else. But the endocrine... Simply put, the way I think of it is that if we put it on our knee, that relayed message has to get back to the rest of our body, right? So from the sensation of pain, it has to receive back to the brain. So it stimulates part of the endocrine system to relay that message back. In other ways, what it may actually do is at least start a signaling pathway to help bring down the inflammation or interrupt some of those other processes that are occurring locally. So the thing I like about local administration, especially for arthritic conditions, is that you don't have to, again, I'm conservative, although I'm a pharmacist, and not scared to try things on myself, which is bad science, try as to the local as possible. If my knee hurts, I want to apply something to my knee. Do I necessarily want to take something that goes throughout my body?
Typical.
I'm just not like that,
Doctor philosophy. Start low and go slow.
Exactly.
Start with the smallest dose in the tiniest place and then work your way up.
Exactly. So I guess if it's like the endocrine system, how does that message relay? I think of it as, where's my endocrine receptors? Throughout my body. So hopefully it's touching on, there's clearly got to be something on a ligament, on an enzyme, on an inflammatory marker that it's interrupting or enhancing or improving upon. And those endocannabinoid receptors may actually be localized pain receptors as well that we're still learning about. So,
and the one that you provide there at Stonegate, what route is that?
We have all the different routes of administration. Okay. Yeah. So we'll have the gummies. We currently need to order more, which is my fault. I forgot. Gummies, drops, flavored drops, balms, capsules. There's
Explain the balms.
So a balm is more of like if you think of, for lack of better words, like a petroleum jelly, right? Yeah. It's a CBD that it's more of like an oil-based product that you can rub for arthritis on your hands or on your knees or any types of joints like that.
And how often are patients doing that?
So for arthritic type symptoms, it's not uncommon. I've seen patients just carry it around with them, and when they get flares,
just as needed,
right? 2 times a day, 3 times a day. I've never seen anybody just continuously, but you will see 2 to 3 times a day is not uncommon. PTSD, it's really at night, I hear a lot of, hey, I'll just take 2 3 gummies. And it's really a titrate as needed is what we're seeing so far.
And is there any toxicity issues or taking too much being a problem?
I think that's what's still being presented in the research, but there hasn't been, to my knowledge, seen any yet. I could be mistaken, but I'm not aware of any at this point. If anything, it's more of it helps with the nervous system healing process. For instance, the endocannabinoid system is beyond important during the 3rd trimester in pregnancy. It's when the nervous system's fully forming, really integrating, and that's when your endocannabinoid system is starting to spike and flare, especially in the fetus, because it's starting to create those neuronal connections that are of just utmost importance.
Absolutely, yeah. And this is a common question I get too, is that when you take the CBD oil, do you get a high? Does that happen?
I think some people would wish you did. But generally, no, you don't get the high. The high, maybe a euphoric feeling, again, as I said earlier, maybe a slight increase in dopamine, especially if you're taking other medications that may be more amplified. But it's non-psychoactive, meaning you're not going to have a high, you're not going to have an altered mental status or anything like that.
And what's your sense, Andy, on this becoming prescription type medication strength, FDA regulated?
I think regulation's great because it's important. We don't want to just have rogue pharmacists, anybody, right? Or just intelligent people just going out there and, biohacking is what's the hot trend right now. That's cool but scary, very scary, right? Non-supervised, that's not good. But I'm conflicted because I think it's insurers may pay for it, may increase availability, but at the same time, will that hinder other companies that have been making this available from making it available?
Yeah.
Or is it all of a sudden going to have a negative stigma on these on things that we've been doing because there's trying to push you towards what's pharmaceutical available, right? So I think it'll be wait and see what'll happen. But at this point, we've already had these availabilities. Why rock the boat? Why all of a sudden turn it into this whole pharmaceutical only, right?
Absolutely.
And that's my fear.
And any final thoughts on CBD oil, Andy?
Don't stigmatize it.
No,
this is phenomenal.
It's a really important, I think, that we just start the conversation with people like us.
Exactly.
Western medicine, internal medicine, doctor pharmacy. I think it's important.
Yes, I agree. Talk to your provider. Don't worry about it.
And a lot of patients, my patients right now are asking me about this, and I said, well, let me talk to Andy, and I think it's going to be a really good jump-off spot for people to start hearing about.
And don't judge us. We're still learning. So.
That's very true. We do not have all the answers yet. But
exactly.
It's important to talk about it.
Agreed.
And Andy, Dr. Ruiz, thank you so much again for coming back. I'd like to thank Founding Media for hosting us, and thank you guys again for tuning in. We'll see you next time.
Thank you.